You are walking through a minefield, blindfolded. You operate under the comfortable assumption that your cardiologist is talking to your rheumatologist. You assume that the pharmacy computer system has a failsafe that catches every single error. You assume that because a bottle is sold on a supermarket shelf, wrapped in bright colors and approved for sale, it is safe to swallow. It is not. The brutal reality is that your doctors operate in silos. The medical system is fragmented, and you are the one standing in the firing line. We need to stop viewing your medicine cabinet as a healing station and start seeing it for what it truly is, a volatile chemistry lab. When you swallow two mismatched pills, they don't just cancel each other out. They trigger a biological collision. They alter your enzymatic landscape. They change the pH of your blood. In over 1.3 million emergency room visits this year alone, the result wasn't healing. It was permanent organ damage, sudden cognitive collapse, or internal hemorrhaging. I am not here to scare you. I am here to arm you. The system has failed to warn you about the microscopic warfare happening inside your veins, so I am going to show you the exact mechanics of the most lethal combinations likely sitting on your shelf right now. We are going to tear down the myths, look at the cold chemistry, and I will give you the exact decontamination protocol to neutralize these threats before they become a statistic. To understand why mixing medications is lethal, you have to stop thinking of pills as magic buttons that simply know where to go. You must understand the mechanics of your liver. Your liver is not just an organ, it is the most complex chemical processing plant in the known universe. Inside this organ, there is a specific family of enzymes known as the cytochrome P450 system. Do not let the scientific name intimidate you. Think of these enzymes as exit doors. Every drug you take, whether it is for blood pressure, cholesterol, or pain, must pass through one of these specific exit doors to leave your body once it has done its job. If it doesn't leave, it becomes a poison. Here is the biological thriller playing out inside you. Many medications compete for the exact same exit door. Imagine a 4-lane highway merging violently into a single lane during rush hour. The cars are the chemical molecules. If you take drug A and drug B at the same time, and they both require the CYP3A4 enzyme to break down, you create a biological traffic jam. The door jams shut. This is where the danger spikes. Because the door is blocked by the first drug, the second drug cannot leave your system. It gets rejected by the liver and forced back into your bloodstream. It recirculates. It builds up. You might be taking the normal prescribed dose, let's say 10 milligrams, but because your body cannot clear it, the levels in your blood rise to toxic heights, mimicking the effect of taking 50 or 100 milligrams. You are effectively accidentally overdosing every single morning simply because the exit route was blocked by another pill. This is not a side effect. This is a mechanical failure of your body's waste disposal system. It is a silent siege on your organs, and you won't feel it happening until the toxicity reaches a critical breaking point. Let's look at the most common and, frankly, the most terrifying mistake I see seniors make. It involves a prescription you need for survival and an over-the-counter pill you take for comfort. I am talking about mixing anticoagulants, blood thinners like warfarin, Eliquis, Xarelto, or Plavix with NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. You know them as ibuprofen, naproxen, Advil, Aleve, or even high-dose aspirin. Because they are sold without a prescription, millions of people assume they are biologically neutral. They are not. Here's the scenario. You have arthritis pain in your knee or a tension headache. You reach for the ibuprofen. You pop 2 pills. Inside your body, a disaster begins. The blood thinner is doing its job. It is suppressing your body's clotting factors to prevent a stroke. It turns your blood from a thick syrup into a thin, free-flowing liquid. But NSAIDs have a visceral, physical mechanism of action. They work by blocking prostaglandins. While this stops pain, prostaglandins are also responsible for maintaining the protective mucus layer of your stomach lining. When you take an NSAID, you are chemically stripping away the armor of your stomach wall. You're leaving the delicate tissue raw and vulnerable to your own stomach acid. Now combine a raw, unprotected stomach wall with blood that has lost the ability to clot. You are creating the perfect storm for a massive internal bleed. The acid eats into a small vessel in the stomach lining. Normally, your body would seal this instantly, but because of the blood thinner, it cannot seal. It bleeds, and it keeps bleeding. You might not feel pain in your stomach. The biological thriller aspect here is the silence of the symptoms. The first sign might be that you feel unusually tired, or you get winded walking to the mailbox. You might see a bruise on your arm that appeared out of nowhere. But the most critical alarm signal, the one that requires you to drive to the ER immediately, is in the toilet bowl. If you see tar-colored, black, sticky stools, that is not a digestive issue. That is digested blood. You are bleeding internally, and your volume is dropping. This combination sends thousands of people to the hospital every year with life-threatening hemorrhages. It is entirely preventable. If you are on a blood thinner, the NSAID shelf is off limits to you unless a doctor is strictly monitoring it. You must use alternatives like acetaminophen, which does not strip the stomach lining. The next trap is what I call the sedation multiplication. This happens when you mix opioids, painkillers like hydrocodone, oxycodone, or morphine, with benzodiazepines like Xanax, Valium, Klonopin, or Ativan. Individually, both of these classes of drugs are central nervous system depressants. They tell your brain to relax. They lower your heart rate. They lower your anxiety. But when you put them together, the effect does not just add up, it multiplies. It is not 1 + 1 = 2. It is 1 + 1 = 10. These drugs target the brainstem. This is the primal lizard brain part of your anatomy that controls your automatic functions. It is the reason you breathe while you are asleep. When you flood the brainstem with both opioids and benzodiazepines simultaneously, you sedate it so deeply that it simply forgets to send the signal to breathe. This is not like holding your breath. This is a chemical shutdown of the respiratory drive. You go to sleep, your respiration slows down, the carbon dioxide builds up in your blood, and you simply never wake up. Even if you survive the night, there is the daytime risk, the fall. You wake up with brain fog, you stand up and the room spins, you stumble. This is often misdiagnosed in seniors as early dementia or just aging clumsiness. It is neither. It is chemical intoxication. You trip, you fall, and you fracture a hip. Let's be clear about what a hip fracture means for a senior. It is not just a broken bone, it is a cement block on your mobility. Statistics show that a significant percentage of seniors who break a hip never regain their full independence, and mortality rates spike in the year following the break. That fracture often marks the beginning of a decline you cannot reverse. If you have ever felt severe brain fog, dizziness, or unsteadiness within an hour of taking your morning medications, do not ignore it. That is not aging. That is your body screaming that the chemical load is too heavy for your brainstem to handle. We need to destroy a dangerous myth right now, the idea that natural equals safe. The internet is flooding your feed with advice to take herbal supplements to boost your mood, memory, or vitality. But herbs are not inert substances. They are powerful, unregulated drugs that happen to grow in the ground. The most dangerous assassin in this category is St. John's wort. Many seniors take St. John's wort for mild depression or mood support. It seems harmless. It's just a flower, right? Wrong. St. John's wort is a potent inducer of the CYP3A4 enzyme. Remember the traffic jam we talked about earlier? St. John's wort does the opposite. It acts like a turbocharger for your liver enzymes. It kicks the exit doors wide open. It forces your liver to process and destroy medications at warp speed. Imagine you are taking a life-saving medication, a blood thinner to prevent strokes, a statin for your heart, or an immunosuppressant after a transplant. You swallow that pill expecting 24 hours of protection. But because you were taking St. John's wort, your liver chews up that medication and flushes it out in 4 hours. You are left with zero protection for 20 hours of the day. You are swallowing the pill every day, you are being compliant, but your body is not getting the medicine. It is being incinerated by the supplement. You could suffer a massive stroke while being fully compliant with your medication simply because a natural tea or capsule stripped the protection from your blood. This is why you must never add a biological agent to your routine without checking the interaction, no matter how natural the label looks or how beautiful the branding is. This next interaction is a silent heart stopper, and it often comes from a place of trying to be healthy. If you are taking ACE inhibitors for blood pressure, drugs ending in pril like lisinopril, enalapril, or ramipril, or angiotensin receptor blockers, ARBs like losartan, you must be hyper-aware of your potassium intake. Here is the mechanism. These specific medications work by blocking a hormone system in your kidneys. They tell your kidneys to release sodium, salt, into your urine to lower your blood pressure. But as a side effect, they tell your kidneys to hold on to potassium. They lock the potassium exit doors. Now imagine you read an article saying seniors need more potassium, so you start eating 3 bananas a day, or you switch to a salt substitute, which is often pure potassium chloride, or you take a multivitamin loaded with minerals. You are now flooding a system that has locked its exit doors. This leads to a condition called hyperkalemia. Think of potassium as the battery fluid for your heart. It tells the muscle when to contract and when to relax. But if you flood the system while taking ACE inhibitors, you aren't just charging the heart, you're short-circuiting it. The excess potassium acts like a heavy cement block sitting on the electrical wire of the heart. The signal fires, but the heart muscle refuses to beat correctly. It doesn't pump, it begins to quiver, a phenomenon known as fibrillation. This is a silent assassin. There is rarely any chest pain. There is rarely a warning sign. You might feel a little nausea or weakness in your legs. The first major symptom is often the last. The heart simply locks up and stops beating. Check the label of your multivitamin today. Does it contain potassium? If you're on blood pressure medication, that small extra amount combined with your diet and your drugs could be tipping the scale into the danger zone. We cannot talk about interactions without addressing the grapefruit effect. This is not an old wives' tale, it is biochemistry. Grapefruit contains compounds called phenocoumarins. When you consume grapefruit juice, these compounds travel to your small intestine and locate the CYP3A4 enzymes. But they don't just block them, they destroy them. They cause suicide inhibition, meaning the enzyme is permanently deactivated and your body has to build new ones from scratch, which takes up to 72 hours. If you take a statin, like atorvastatin or simvastatin, or a calcium channel blocker for blood pressure during this 72-hour window, the drug has nowhere to go. It cannot be broken down. It passes directly into your bloodstream at full potency. 1 glass of grapefruit juice can boost the levels of these drugs in your blood by 300% to 500%. It turns a single pill into a toxic overdose. With statins, this can lead to rhabdomyolysis, a horrific condition where your muscle tissue begins to dissolve, releasing proteins that clog your kidneys and cause kidney failure. If your bottle says, "Do not take with grapefruit," obey it as if it were a law of physics. It is not a suggestion. There is another hidden danger lurking in the cold and flu aisle that poses a catastrophic risk for anyone managing hypertension. I am talking about the interaction between high blood pressure and decongestants, specifically pseudoephedrine and phenylephrine. You have a cold, your nose is blocked, and you're miserable. You buy a standard decongestant. You assume it is safe because it doesn't require a prescription, but you need to understand the mechanics of how a decongestant clears your nose. It works by vasoconstriction. It chemically clamps down on the blood vessels in your nasal passages to stop the swelling. The problem is the drug does not stay in your nose. It travels systemically through your entire body. It clamps down on all your blood vessels. It tightens the arteries. If you are already fighting high blood pressure, taking a decongestant is like throwing gasoline on a fire. You are chemically forcing your blood pressure to spike. I have seen patients come in with hypertensive crises, strokes, heart attacks, and retinal bleeding triggered simply because they took a D version of an allergy pill, like Claritin D or Allegra D.
If you have high blood pressure, you must look for products specifically labeled quercetin or HBP, high blood pressure safe, which do not contain these constricting agents. Do not sacrifice your heart health for a clear nose. We must also shine a light on the hidden overdose involving acetaminophen. You know it as Tylenol. It is one of the safest drugs in the world when used correctly, but it has a very narrow therapeutic window. The liver can only process a specific amount of acetaminophen, typically 3,000 to 4,000 milligrams per day, before the pathway becomes saturated. Once saturated, the drug converts into a toxic metabolite that destroys liver cells. The danger is not that you will swallow a handful of Tylenol pills on purpose. The danger is the stacking effect. You wake up with back pain, so you take 2 extra-strength Tylenol, 1,000 milligrams. Later, you feel a cold coming on, so you drink a packet of Theraflu or take a Dayquil. Did you check the label? Those cold medicines also contain acetaminophen. Later that night, you take a PM sleep aid. That also contains acetaminophen. Without realizing it, you have stacked 3 different products that all contain the same active ingredient. You have inadvertently crossed the toxicity threshold. This is the leading cause of acute liver failure in the Western world. It is not alcoholics. It is regular people trying to treat a cold and back pain on the same day. You must become a detective. Read the active ingredients list on every box. If you see acetaminophen or APAP listed on 2 different boxes, you cannot take them together. You are poisoning your liver by doubling down on the same chemical pathway. There is a systemic failure in modern medicine that you need to identify to save yourself. It is called the prescribing cascade. This happens when a side effect of one drug is mistaken for a new disease, leading to a prescription for a second drug. It starts innocently. Step 1. You take an NSAID for arthritis. Step 2. That pill raises your blood pressure as a side effect. Step 3, your doctor sees the high blood pressure, doesn't realize it's from the arthritis pill, and prescribes a blood pressure medication, like a calcium channel blocker. Step 4, that medication causes fluid retention and ankle swelling. Step 5, the doctor sees the swelling and prescribes a diuretic, water pill. Step 6, the diuretic makes you urinate frequently and lose bladder control. Step 7, you are prescribed a bladder control pill. You are now on 4 medications, but you only have one condition, arthritis. The rest is a domino effect of chemical management. You are treating side effects, not diseases. And every new drug adds a new set of interactions to the cocktail. You must stop this assembly line. Whenever you develop a new symptom after starting a medication, you must ask the hard question. Is this actually a new condition, or is this a side effect of the drug I started last week? Do not let them treat the symptom without investigating the cause. Knowledge is useless without action. I am going to give you a protocol that can save your life. It is called the brown bag audit. Do not rely on the printed list from your doctor's office. That list is often outdated. It doesn't show what you actually take, and it certainly doesn't show the herbal supplements you bought on Amazon. Here is the protocol. 1. Gather. Take a physical brown paper bag. Go through your house. I want you to put every single thing you swallow into that bag. Prescription bottles, over-the-counter pain relief, vitamins, herbal supplements, eye drops, laxatives, powders, everything. 2. Transport. Take this bag to your pharmacist. Not the drive-through window. Go inside. If your pharmacy is too busy, find a smaller, independent pharmacy. 3. The ask. Ask for a comprehensive medication review. Pharmacists are the true chemistry experts of the medical world. They understand interactions better than most general practitioners because that is their sole focus. 4. The questions. Dump the bag on the counter and ask 2 specific questions. Are any of these drugs competing for the same enzyme, and can we de-prescribe any of these? You will be shocked at what they find.
Often they will find two drugs doing the exact same thing or a supplement that is neutralizing your heart medication. This 20-minute audit is worth more than 10 years of standard checkups. Comment the word audit below if you are willing to do the brown bag check this week. Let's hold each other accountable and clean up these dangerous cocktails. Finally, let's talk about the logistics of your biology. Your kidneys and liver need a medium to flush out toxins and process drugs. That medium is water. We often treat drink more water as soft wellness advice. I want you to reframe it as a decontamination mechanism. Your kidneys are the waste management plant of your body, but they cannot move dry, toxic waste. They require a flow. When you take strong medication while dehydrated, you are turning a therapeutic dose into a stagnant, toxic sludge. Without water, the drug concentrates in the kidney tissues, acting like acid in a pipe. It crystallizes. It damages the delicate filters. This is how drug-induced kidney injury begins. You must change your strategy. Unless you are on a strict fluid restriction from your cardiologist for heart failure, visualize the water as the transport convoy.
It doesn't just swallow the pill, it blasts open the exit doors, ensuring the chemicals leave your body before they can poison the filter. The rule: drink a full 8-ounce glass of water with every single medication dose. Never take a pill dry or with just a sip of coffee. Coffee is a diuretic. It dehydrates you further. You need pure water to dilute the chemical load. In addition to water, you must utilize time. If you are taking multiple medications, ask your pharmacist if they can be spaced out. Swallowing 5 pills at 8 a.m. creates a massive peak load for your liver to process all at once. It's like a denial of service attack on your enzymes. By moving 2 of those pills to noon, if safe to do so, you create a buffer zone. You give your liver processing time to handle one chemical load before the next one hits. This simple scheduling change can drastically reduce the risk of the traffic jam effect we discussed earlier. You are not a passive vessel for pills. You are the CEO of your own health, and you are the guardian of a complex biological ecosystem. The standard medical approach treats the average human, but you are an individual with a unique chemistry. However, a critical safety warning: never stop a prescribed medication cold turkey based on this video or any internet advice. Stopping a beta blocker, an antidepressant, or a blood pressure medication suddenly can cause rebound effects that are more dangerous than the interaction itself. Your blood pressure could skyrocket to stroke levels. Your heart rhythm could destabilize. The goal of this information is not to make you quit your meds. The goal is to arm you for a conversation. The goal is to make you an active participant in your survival rather than a bystander. Take this knowledge to your doctor. Ask the questions. Demand the audit. Protect your liver, protect your kidneys, and protect your life. If you found this vital, you need to see our next guide. We have a specific breakdown on the anticholinergic burden, the drugs that mimic dementia. Check out our other great video about is it dementia or your meds to dive even deeper into the specific brand names that steal your memory. Click the video on screen now to continue the protocol.